the medical director of the Oakland County Health Department, joins us via Zoom. And thank you very much for joining us this morning. We're all learning through this process, sir.
Thanks for the invitation to be here. And I just want to give a shout out to Officer Lawson for all our law enforcement is doing, and his encouragement for folks to wear, cloth face coverings when they're out in public, and to maintain this, even though people are fed up and they've got cabin fever and they want to get out and about. I suspect this is going to be our new normal. Moving ahead and moving beyond the end of this month and into May and June, et cetera. As the restrictions are loosened up, we are going to need to be vigilant about wearing face coverings and washing our hands and maintaining social distancing practices so we can prevent a second peak of COVID-19 in our communities, and especially in those most vulnerable. I really want to emphasize this before we do anything else, emphasize to our listeners and watchers that we need to keep COVID-19 out of our elderly community, who invariably have many comorbidities, that is, additional issues, health issues that we all accumulate as we mature, let's say, as we age. Cardiovascular disease or chronic lung disease, high blood pressure, things like that make us much more vulnerable.
Well, it's well said, Dr. Foust. I appreciate that message. And, it's on us now, okay? Likely over the next couple of months, things are going to open up a little bit. We've all been at home, and as a community, it's probably a little bit easier, a little bit safer when we're all at home. Now, it's on all of us to pull this off together. Okay, it absolutely is, because now as things open up, maybe we'll hear from the governor this afternoon. I don't know what she's going to talk about, but at some point, phase 1, phase 2, phase 3 of the federal program that you've been hearing the president and others talk about, or whatever she comes up with, whatever it is, it's not going to be what we've been doing. So we really have to step up our game now, and I'm really glad you're on the show with us and taking time to remind people of the things they need to do. I think we've done pretty well. U of M said this morning in an article I read that here in Oakland County, we are seeing a plateau. What are you seeing, sir?
I'm a little ambivalent about announcing something like a plateau. We still have cases increasing. We still have additional cases every day. And it's not clear. There's just no way to be able to accurately say where we are on the clinical curve without readily available testing widespread through our community. And we know we just haven't had that. We haven't had that from the very beginning. That was the major shortage, was the availability of testing for COVID-19. And we continue to have a deficit nationally and locally. I will say this, our fatalities will continue to peak. We have not even come close to the peak of fatalities. And again, disproportionately in our most vulnerable populations, our elderly.
Well, I'm an optimistic by nature, so you have to forgive me. But you're right, and I've seen those numbers too, and it's so disheartening to see that while we are seeing some of the other numbers certainly starting to go in the right direction, and I understand your caution, and I respect that with your comments today, but we're not seeing that on the fatalities, and that's got to be a little frustrating. We're not. It's a bellwether that we're not there yet.
Agreed. Just to give you a sense, as of this morning, we had 6,170 positive confirmed cases in Oakland County. That's out of a total of about 18,000 tests conducted. And that comes up to about a 33% positive rate. Now, that is a little bit of a biased number in that up until recently, most of the hospitals have only been testing those that are the most ill, the most severely symptomatic. So naturally, there would be a fairly high percentage of those folks being positive by testing for COVID-19. I'm optimistic, as you are, as we're adding testing at all our hospitals, as well as some drive-up sites in the county, and through availability of additional testing from commercial or private laboratories. We've just opened up drive-up testing here at Oakland County at our Pontiac campus, near the courts in the Pontiac Oakland County campus. So let me just mention a couple things. We must have an appointment to get a test. There's no same day registration and drive up. You can't just drive up and expect to be tested. But some great news relative to other sites. You don't need a physician's prescription. You don't need money. This is free of charge. So for the general population, for the general public, they must have symptoms, and that's about it. So we have really lowered the bar for requirements to be tested. And in addition, as of today, I think you mentioned this a couple minutes ago, those in healthcare, those in critical infrastructure, and those first responders don't even need to have symptoms. They just simply call, get an appointment, and get here and get testing. I will tell you this, it might take you a day or two to get in to have an appointment, but our turnaround at the lab is extremely quick. We're talking 24 to 48 hours. So even compared to other sites that can get you in today to be tested, they're not getting their results back for a week. So we can get your results fairly quickly on a relatively basis.
Well, that is great news. Dr. Russell Foust joining us. He's a medical director, Oakland County Health Department. And that is really good news. Good to hear the first responders can get in and test regardless of their situation. So many of us asymptomatic, likely. It's good that they can go in and find out because they're right there in the front line and they're very exposed. I thought I saw a report, too, that St. Joe also is going to have some drive-in testing, and that people can go there, and they have increased capacity for testing in Oakland County as well.
There are several hospitals right now. I believe originally West Bloomfield Henry Ford had opened up a drive-up testing. I'm not sure whether that's still open or not. I know Beaumont Royal Oak has drive-up testing. Of course, there's a state fairgrounds down in Wayne County, and they have drive-up testing. As you say, I believe St. Joe's is now opening up as well.
Yeah, it's good news. There seems to be more. Now, clearly, we had a little debate over the weekend in the media, played out in the media, and what I really appreciate about you coming on and this show is that we're so local. We can find out what's really happening right here to the best of our ability, and it doesn't matter what one person or one pundit says on the national news. So we did hear the president say there's plenty of testing, and then we heard Governor Whitmer say, and I hear you laughing, we'll give you a chance to respond, and then I heard Governor Whitmer say, well, yeah, but we don't have the swabs, and we don't have the other stuff. Now, as I understand it, correct me if I'm wrong, Dr. Foust, a lot of the supplies for Oakland County, they come through your department and then get distributed out. A, is that true? And B, where are we at with supplies here in Oakland County?
Oh, man, that is all over the board. In fact, we are contracting with multiple laboratories. Some of those laboratories, as part of the testing charge, include swabs and viral transport medium and all the necessary reagents to perform the test. Other laboratories will run the test if we get a sample to them, meaning we have to come up with the swab and the viral transport medium and get it to them. And they're all over the board. And at the other end of that spectrum are laboratories that have the PCR machine, and they might have the primers to perform that test. They just can't get their hands on the reagents to perform the PCR or polymerase chain reaction molecular test. And again, Whitmer's absolutely right. There are not enough supplies for us to conduct testing community-wide as we really need to. I mean, this must happen for us to know where we are on the clinical curve. That is, are we still going to peak? You know, how widespread is this in our community, to know how and when we can begin to loosen up restrictions to avoid a second peak and major fatalities. We really need to know where we are on the curve, and that's our goal here for setting up testing and you know, lowering the bar to get folks in there and get our community tested.
I appreciate everything you're doing. And good news, especially for our first responders. Good to see that there's more testing. Do you see a day? And I know your job is to, you know, not be a pundit and predict, but do you see a day where down the road at some point we might have enough testing where you could literally go to your local corner pharmacy and maybe get a test and see where we're at? Is that a possible interim situation before we have vaccines, before we have other medications that can help cure or help us at least through this virus?
No, I think you're right. I believe I have heard rumors over the weekend of some national chain pharmacies actually beginning to conduct testing. And it wasn't clear to me whether that was the approved molecular testing to diagnose COVID-19, or whether that was the antibody test to look for the buildup of an immune response. And let me just be very clear: those antibody tests are not to diagnose COVID-19. They're really looking for someone's antibody titer. They're looking for whether or not you've been exposed, perhaps been infected, and whether you're mounting an immune response with antibodies.
Are you in touch with the governor's office, and do health departments and directors like yourself, Russell Foust, are you talking with the other departments and talking with the governor? And I mean, you're right in the front line. Oakland County is certainly unfortunately, we are one of the most impacted counties in the nation right here.
We are. So we have the statewide Association of Medical Directors and Preventive Care Physicians, and we're in contact with each other. There must be at least a dozen emails a day and regular phone calls. And we are in direct contact through myself, our director here at Oakland County, Director of Health and Human Services, as well as our health officer. So Director Kathy Forsley, Health Officer Leanne Stafford, with the health officer at State, Jonae Caldoun. So, and I have to say, Dr. Caldoun is really very responsive to the statewide health experts that can consult with her and confer with her regularly.
Well, Dr. Foust, I appreciate you taking time for us today. We got a great team here. You in Oakland County, Dr. Caldoun in Lansing, and we have to be cautious. But I know you understand that all of us who are living with this in our homes every day, and I'm one of the lucky ones. I'm an essential worker. I get to get out of the house and come to the studio. But for most of the people tuning in right now, all across Oakland County, they're still in their home. It's really, really tough for them, and we know that you're doing the best to get the right medical answers so we can open this up and do it in a safe way. And I know that's what you're working on. Is that correct?
We are, absolutely. I think ramping up testing as aggressively as we can right now is going to give us a better sense of how pervasive this is in our community. And we're trying to add antibody testing to get a sense of how many have recovered from a COVID-19 infection and really get the data. We have to know where we are on the clinical curve to know what to expect on the far side of that curve. Let me just give you the optimistic view right now. Fortunately, right now, as we head toward loosening restrictions, and I can't predict when that will be, but as we head in that direction, note that we now have PPE. We have the things in place that we didn't have 2 months ago when we entered this crisis. We now have personal protective equipment. We have masks, we have gowns, we have gloves, we have face shields. We get in more all the time. We have manufacturers, local and regional, ramping up production of these absolutely essential protective equipment for our front line and our healthcare providers. So that's a huge positive. We have testing coming online now. Certainly there will be some level of immunity in our community now, as we'll have some uncertain number of people who have been infected with COVID-19, have recovered now, and they likely will not become reinfected. So we have that as an advantage and our benefit as we head past this curve. I think we're ready now. We have more than 100 people now trained in Oakland County Health Division to perform contact investigations and trace investigations, things that we just didn't have 2 months ago, and ramp that up. So I think we're in a much better position now to prevent a second peak, a huge number of fatalities, and to, quote, flatten the curve. I think we're in a much better position.
All right. Well, Dr. Faust, that'll happen because a lot of good work and a lot of cooperation. Is that tracking? Is that happening with CDC people that are here in Michigan, or are we doing that ourselves locally with local county health departments and state people and local physicians, or how is that working?
Yeah, we do that locally. As I say, we've trained over 100 people here to perform those contact investigations. And a lot of it's coordinated with state. That is, regardless of where someone tests positive, wherever that positive test result comes up, it's communicated to the state. It's entered into the state database. That's communicated back to us. That happens fairly rapidly, and we coordinate with them. Originally, it was a direct phone call. Mm-hmm. Now it's automated, and we begin to conduct that investigation.
Dr. Faust, you've been so generous with your time. One final question. I'm thinking that, we have enormous challenges here in Oakland County, but we also have a lot of resources. And as a lot of us get ready to head up north, hopefully, for at least some point during the summer and go to less populous counties, is it possible that those counties are not as equipped as you are in Oakland County to deal with some of this?
That's a great point, and thank you for asking. They are absolutely not as well equipped. We have hospitals here in Oakland County that are part of large systems, even multi-state systems, and they've had the resources, frankly, to be able to recruit resources, that is equipment such as ventilators, to redeploy staff such as nurses and emergency physicians and hospitalists, to bring them in from their distant hospitals in less populated settings in order to manage through this crisis here. So I think for those folks, those systems, they'll be able to redeploy to the less populated and less prepared communities. I'm worried about those communities that have a standalone hospital that are not part of a large system. And I think based on what I've seen so far, I think these hospitals and systems are going to be team players and be generous with regard to redeploying things like ventilators and staff. So I think they'll be okay, but that is certainly a concern. I'm worried about those little towns.
All right. Well, hopefully we will all work together to get through this, and hopefully as we come out of this, we do it in a smart way. And you're doing everything you can. Great job. I know they're doing the best they can in Lansing as well, and now we're just going to work real hard, do our job to make sure that all the folks that are tuning in and everyone they know is washing their hands and taking care of themselves and putting those bandanas or face masks on or do whatever they need to do. I also pulled, I want to make sure I get this right, I did pull the number for the hotline to call if you want to get tested in Oakland County. And if my information is correct, that number is 248-848-5533. 248-848-5533. That'll get you to the nurse on-call hotline. And again, Dr. Faust,
let's make that the 800 number.
Okay.
Let's make it 800-848-5533.
Even better yet, toll free, the whole thing, and it's free. You get tested in Oakland County at the county building. You don't have to pay a penny. Is that correct, sir?
That's absolutely correct.
All right. So call that number.
No copay, no nothing.
Call that number. They'll get you in. You just got to say that you're not feeling well, and you'll probably get a test, right?
Yes.
All right. Thank you very much. Been charitable with
Thank
your time.
you.
We appreciate it. Let's keep in touch.
Thank you.
He is Dr. Russell Foust, Medical Director, Oakland County Health Department.